record. So first of all, welcome to our live Q&A, and thank you for our panelists and all of you attendees for coming along. We've got Paul Smith, who is the Assistant Director of All Age Commissioning from Herefordshire Council, Dr. Simon Lennane, who is a GP from Alton Street in Ross-on-Wye and also mental health lead for Herefordshire GP practices. And we also have Clare Powney, who is from Dementia Matters Here, a local charity that has been very busy this week because it's Dementia Action Week in Herefordshire. So I'm going to ask each of the panelists in a minute to introduce themselves in a little bit more detail, their roles and their contribution, if you like, and their thinking around dementia and dementia care in Herefordshire. So first of all, I'm Christine Price from Healthwatch. I should have mentioned that earlier. And Healthwatch is, for those of you who might not know, an independent consumer champion for health and social care in Herefordshire. Our role is to provide information and advice about health and social care, to gather views from the public around health and social care, to inform development of services, to improve services with your views in mind, and also to get you involved in shaping services to meet your needs. Probably in a nutshell, that's probably as much as I want to say. Whilst we're on this webinar, I did want to raise a really important survey that we want feedback on at the moment, which is probably relevant to many of you on the call. And it's basically asking people to give us their views on making choices about future care and what you might need to know and what information you might need to look for to do that. This might be something you're considering in the near future. It might be something you've recently considered. So if you're interested, I'm going to pop a link in the chat, and I'll also put an email address of Mary, our engagement officer, if you want to talk to her about the project in any more detail, because we really like to get the word out and get more people to tell us their views about that particular topic. So enough from me, and I'll firstly go to Paul and ask Paul to open the session with his remarks.
Good afternoon, guys, and anybody that's listening on Facebook. Good afternoon, I'm Paul Smith. I'm the Assistant Director for Commissioning for Herefordshire Council. Many of the people on the panel today are close colleagues of mine, and we work together collectively as a system to hopefully support people and families and carers who are impacted by dementia. And in addition to that, we try to push the dementia agenda up as high up the political sphere as we can to ensure that funding services and recognition of dementia as a condition is as high as it possibly can be. My particular responsibility is for the commissioning, or often more think of it more of the purchasing of services on behalf of the council. So care homes, domiciliary care agencies, voluntary sector agencies, and also partnerships with our NHS partners such as Healthwatch and the Acute Trust and GPs and the Mental Health Trust, etc. So I'm sort of responsible for those services, the more formal services perhaps, and also work alongside colleagues in the voluntary sector to ensure that we work together to ensure that Herefordshire and Worcester has a fantastic response to this particular agenda around dementia. And ultimately, if you have a problem with a service in Herefordshire linked to dementia, it might end up on my desk, or it might end up on Christine's desk initially, and then at some point we'll discuss it as a system and try and resolve those issues on your behalf. Looking forward to today's session. Thank you very much for joining, and any questions you have for the panel, we always welcome them. Good afternoon.
Simon, do you want to go next?
Thanks, Christine. I'm Simon Lennane. I'm a GP in Ross-on-Wye, and I'm also the mental health lead for the commissioning group, which means that I bring a GP perspective to the decisions about how healthcare is made, because I essentially work as a jobbing GP. I see patients every day, and that gives me a good feel for where the blocks are within the system. It tells me, you know, if people are waiting too long for a particular thing, and that helps to feed into the decisions that are made around provision within the county. I'm also a trustee of the Community Development Trust in Ross, which we set up to try and empower the local voluntary sector. We've got a really strong voluntary sector in Ross, and one of the things I'm most proud of is the Dementia Meeting Centre in Ross, which follows the model, a really successful model in Leinster. And it's a shame that that's closed from COVID. That's been really frustrating. I'd love to see that open up again, because I think that's really, really beneficial. I'm sure Shirley is far more familiar with the evidence behind these, but the meeting centres are really, really powerful, really good and beneficial, both for people with dementia and for their carers as well. So I'd love to see that start up as we come out of COVID, as the kind of floodwaters of COVID subside and we start coming back to normality. My other role is a clinical director of the Primary Care Network, which involves coordinating some of the other practices, but I'm stepping down from that actually to focus on kind of day job now. So yeah, please do bring in your questions, and we'll try and answer as many as we can. Thanks, Christy.
And Claire. You're on mute.
Good afternoon, folks. I'm Clare Powney. I'm co-founder and chief officer of Dementia Matters Herefordshire, to give it its full title. My role is to manage the day-to-day running of Dementia Matters here, and to develop our strategy and funding streams for the charity. We cover supporting people across Herefordshire, and we also support people with mild cognitive impairment and carers of people who are currently in a care setting where there has been some gaps previously in provision. We're commissioned by Herefordshire and Worcestershire Clinical Commissioning Group to deliver the Dementia Community Support Service across Herefordshire. So I have a team of 2 who work with me to deliver that, and that includes our one-to-one support and befriending service, our telephone support line, carers support group, which is specific for people who are caring for somebody with a dementia, online meeting point, which is an online form of the meeting centre and follows the meeting centre UK Meeting Centre programme ethos. And we also, for anybody who would like it, publish a fortnightly newsletter.
Thanks, Claire. And do you want to say a little bit about the Dementia Action Week that's happening this week?
Dementia Action Week, yes. Well, we've collaborated across the board really with that. We've worked with Leinster Meeting Centre, Dementia Friendly Leinster, one of the GP practices in Leinster as well, and Herefordshire DAA. So we've had a really successful week, thanks really to Shirley and her extraordinarily hard work over the last few weeks, putting it all together. But yes, we have managed to deliver programme every day of this week so far. And we've had, as Shirley has already said, I think we've had quite a good response, really, to be fair. And one of my team, Charlotte, has managed to get at least 25 care settings and one in Lancashire to do our picnic, which is, we're hoping to be one of the biggest synchronised picnics held in the country. So once we've gathered all the pictures and information back, we'll collate it all and then see how we did.
Indoors, most likely, I guess.
I think most of it was, yeah. Yeah. Dementia Matters here, a lot of our members were doing it, getting together and doing it from one another's houses. So that's been a nice sort of side bit to it as well. So yeah, no, I think it's been inside, admittedly, but pretty good, actually.
Thanks, Claire. Can I ask Paul and Simon to give us a rough sketch outline of where we are with dementia in the county, and potentially impact of COVID on dementia care. I don't know which one of you would like to go first, Simon.
I'd like to, if that's okay. Yeah, I mean, it's really, sorry, if that's all right, Paul. This is such a topical issue for us as GPs. There's a real bulk of workload coming through at the moment, because I think what's happened is we had a year where people were very uncertain about coming into the practice, and there were times, certainly over the winter, when I would have said, look, try and stay away from us as well, because we weren't vaccinated, case rates were really high, and we were doing everything remotely. But now we're coming through the other side of it. People, and the vast majority of certainly the people we're seeing have been vaccinated, so it's far, far safer. We've been open all the way through, but we're seeing people face to face. But what I'm seeing is lots and lots of people with concerns about their memory. And lots of people, far more than I normally do. We're always very keen to hear from people who say, yes, I've got issues about my memory, I'm worried about it. But and I think that's the main point that I want to raise, is really that we're seeing now the harms of what's happened over the last year, and I think the damage that it's caused. And what I think has been happening is that the confidence and the engagement that we have with other people, those kind of ties where we see other people and talk to them, and people have been isolated, they've been stuck in the same four walls for over a year now, and understandably so. But a lot of people have lost confidence, have lost almost the language that we use when we're communicating with people. And so actually I've investigated a few people, and the tests have all come back normal, which it can happen with dementia anyway. But what we're seeing is that I think that it's more a confidence issue than actually necessarily the progression of dementia, but we still really, really need to be assessing people. So what I'm trying to say to people is essentially, I'd really, really like you to go out and start engaging with people, but talking to people, spending time with people, and really just to try and get back to normal. Case rates are really low. It's really safe. If you meet outside, it is incredibly safe. With a mask and outdoors, it's impossible really to catch COVID. If you're vaccinated and you're careful and you get the windows open, we can mix safely, we can spend time with each other. That's what we need to do, because it's no good for us to be stuck in the same four walls talking to the same person every day. And that's the direction we need to go in. The council are doing some fantastic stuff with the talkcommunity.org website, trying to encourage interactions and trying to get people talking, but that's where we need to be. I'm sure people are seeing that elsewhere, but certainly on the front line of the NHS, there's a lot of concern about memory problems, and this is something that's new for us, seeing such a bulk of this stuff coming through. We're keen to see and assess people, but there are things that you can do to help if you're concerned about your memory.
Thanks, Simon. Paul, do you want to contribute there?
Yeah, thanks, Simon. Great reflection of the work that's been done in the community, particularly, and perhaps I'm going to take a slightly different angle in that the COVID pandemic, of course, which we're still in, even though we are hopefully over the side of that curve, and we're absolutely in a position. And I know this morning there's no cases in the hospital in Hereford, and that's been the case for a few days, which is fantastic. And we all should embrace our newly found freedoms again, perhaps, in the way that Simon suggested. I absolutely support that. But what the system has done over the last 12 months, I think one of the huge advantages of the pandemic for people with dementia, but also for the wider group of vulnerable individuals in the county, is it's brought the system together so that the cross collaboration working across the NHS, the local authority, GPs, the voluntary sector, and the community themselves has been absolutely incredible over the last 12 months. I have to say I've been really proud to be part of that Herefordshire system. I don't actually live in Hereford, I live in Paris, but I have to say the Herefordshire system has been an example to everybody, to say this is what you can achieve if you actually work together. And I would like to just offer personal thanks to all of the care workers, both in the community and in care homes particularly, who've been working throughout the pandemic and have been bravely continuing their roles and supporting people and ensuring that people with dementia haven't suffered unduly. Of course, it's been disruptive, and of course, it's been difficult. Visiting hasn't been able to take place. care workers have had to be incredibly vigilant and wear lots of PPE and change it regularly. And that makes life difficult when you're in a care home because it's your home and you're not used to seeing the people that support you with masks, etc. But I would like to pay absolute tribute to the care sector, particularly, and the health and the NHS over the last 12 months. And I think from a dementia perspective, it's always really difficult because, of course, seeing somebody in PPE can be quite frightening if you're not used to that. It's not a good look, let's be honest. But the system has invested literally millions and millions of pounds into the care over the last 12 months. The council still provides PPE free of charge to all care providers, and we have done for almost 12 months. We still have weekly forums with providers to ensure that we can support providers to support people with dementia, and long may that continue. And I would hope that Herefordshire does pat itself on the back a little bit because, of course, we're a rural county, so it is a different position than a very, very densely populated urban area. But I think that the system has done an incredible job, and the community is the main part of that. Communities have clubbed together, they've worked together, they've supported their colleagues and carers and their relatives with dementia. And most importantly, when people have been asked to just go that little extra mile, I think everybody has stood up and done that. And as a result, I think we've had a really positive a pandemic as it was possible to have. And of course, there would be no positives in a pandemic to some extent. But I think it's been as positive an experience as we could possibly have made it. And I think that the very fact that we're now out mixing and really looking forward to the other side of the summer when perhaps normality may return and people with dementia can be supported in the way that they were prior to the pandemic. I'm certainly looking forward to next weekend where I'm going to go and hug my own mother, who I haven't seen for 12 months. And I'm really looking forward to that. I'm not sure she is, if I'm being honest with you, but I certainly am. So I would just say thank you to all the care workers and the NHS workers that have supported people with dementia throughout the last 12 months.
Thanks, Paul. Lots of positive things for Herefordshire, I think. So moving on to some questions, we've got a few in advance. So the first one is actually from Tracy, who's on the call. And Tracy asks, what training or education is available for carers looking after a loved one with dementia locally? Is there support with practical issues and how to manage difficult behaviour? So, Claire, do you want to take that one?
Yeah, I'll take that one. Well, we've just actually launched some face-to-face carers education and support group in Leominster at the Forbury. That meets on alternate Tuesday and Thursday mornings. The lady that is delivering that at the moment for us is a member of my team who is Cheryl Paul, who will probably be well known to a lot of people on this call. So she has now started to deliver face-to-face support for carers with an education flip to it as well. It's a nice mix. But also Dementia Matters here, we deliver a carers support group on a Tuesday evening at 7:30 via Zoom, which anybody is welcome to join. That involves education as well as support and chat and a cuppa. And in fact, it's quite a popular group that we deliver that one. I think because it is specifically for people who are looking after somebody with a diagnosis, or somebody who is, we have got a couple of people who are sort of pre-diagnosis, that we are supporting via that group as well. So there's a bit out there. Also, we have actually been approached by a couple of care venues, as to whether we would actually deliver some education for their staff and for carers there. So that is brewing on my list of to do currently at the moment, and we have got a bit of format for delivering some of that. It's actually to a couple of, well, Paul will know them. Hillside is one of them. We've been approached by them. So there is training available, and if people want to contact us, we are happy to look at delivering it, across Herefordshire. So if you want to contact us, we're more than happy to discuss.
I'm on mute. If anybody's interested in carer support, drop us an email, because we can link you in with various carer support groups across the county, as well as the Dementia Matters Here one. Simon, did you want to come in and say something?
Just wanted to make a plug essentially for Dementia Friends training. I think it's one of the most useful things that anyone can do. And certainly, having worked in elderly medicine for years, I still find I learn something every time I attend a Dementia Friends training session. It's funny that sometimes I've been to a couple of sessions where GPs have been involved, and there's a point at which they put down their phones and they start really focusing, because it's so powerful. And so I would strongly encourage everyone to attend a session if they can. I was just looking on the website, there's Dementia Friends UK. I'm not sure if there are any face-to-face groups, because those are the ones that I've been to pre-COVID, and I don't know at what point we'll be able to get those going again. But if you do have the chance to do a Dementia Friends training, it's very, very useful for anyone who has any kind of role for it. It just gives you an insight into what dementia is, because there are lots of myths around dementia, and it's the most useful way of being able to understand it. Thanks, Christine.
Shirley, did you want to come in?
Yeah, we've been delivering online Dementia Friends sessions this week, and that works absolutely really well. When I went to do one on Monday morning, first thing, I realised I hadn't done it for 4 years, but I had all the slides ready, and yeah, we can do them online. Works brilliant. Thanks.
Paul, did you have anything to add in terms of training available for carers?
Well, only that I wasn't aware of the request, Clare, from Hillside, but of course I'm supportive of that, because that's the council's own run care home. We do have quite a healthy training budget, actually, and we have a very active workforce development coordinator within the council. So I'll make that connection, Clare. You may already know Tammy Moss, but I will make that connection. And we will attempt, with Shirley's absolute endorsement of online, we will try to spread that net a bit wider, because I do believe that we are in the position where Zoom training and those sort of issues can spread the net wider than we have done previously. Of course, we'll return to face-to-face, and we certainly undertake a number of training sessions with care providers and also carers organisations, but we will perhaps look at the online approach to try and spread that net a little wider. So that's a great suggestion, and I'll ensure that Clare and Tammy speak, and we can see whether, if that works well at Hillside, let's try and spread that out a little bit wider to other care homes as well. Absolutely.
I have actually been talking to Tammy and Justine, Paul, so yeah, we're in touch.
Thank you.
Is there any potential from the council to support unpaid carers in a similar way with some training around behaviours and managing loved ones with dementia?
Yeah. Well, absolutely. From my perspective, I believe strongly that when we have a training offer, that it should be universal, and it should be available to both professionals and non-professionals. And in some ways, it's almost more important that it gets to the non-professionals, because you would kind of hope that the professionals are already trained and capable and competent. And of course, many of us will encounter dementia in our lives through a relative, and we may know nothing about dementia when that first arises. So it's really important that the non-professionals can access that. So again, I'll talk to the individuals on the call that are involved in this, and we'll see what we can do to do that, because that's certainly be a huge advantage. And of course, it's a massive piece of prevention.
So talking about prevention leads nicely on to my next question. The next question is, what preventative measures or steps can one take to reduce risk factors of developing dementia in the first place? Simon, do you want to take that one?
Yeah. Again, it's so important. You know, dementia happens, but there are things that you can do to reduce your risk of it. essentially there's a spectrum between kind of Alzheimer's type dementia and vascular dementia, and people with a diagnosis is somewhere between the two, but your vascular risk factors are the things that we can make the most difference for. What that means is your risk of getting strokes or mini strokes that basically affect the blood supply to the brain, which can then lead to conditions such as dementia. So we're really focused on this to try and improve these things. So these are things like smoking, identifying and treating diabetes and getting really good sugar level control is really important. Recognizing people who've got high cholesterol and treating that as well. And all of these things prevent dementia. You can't do much about the other risk factors, which are essentially age. You know, it's not something that you can change, and you can't do much about your family history because it's kind of there with you. So treat the things that you can treat. So keeping active is really important. Getting ideally 30 minutes a day of exercise, enough to get you out of breath so that you can't speak in a whole sentence. That kind of level of breathing is really important. Our bodies are made to do this, and if we're sedentary and we're not getting this and we drive everywhere, then it's not good for us, and that really significantly increases the risk of dementia. The other thing is keeping your connections going, is spending time with other people, is making sure you're using your language, it's making sure you're making the most of your community and your connections with people, and so keeping up with people. And that again, it comes back to my worry about COVID, that we're losing those wider links with people. We're seeing families and, you know, talking by Zoom, it's not the same, but actually it's the wider links. You know, it's talking to the neighbour who's, you know, a little bit further down the street. It's, you know, chatting with the person in the shop, and we're losing those connections, and they're a really important part of our social selves, really, our associational life. So the things that now it's safe to be going out and doing things again, and it's really important to be picking those up, to be getting on with things. So, you know, using things as well, using your language, using your mind, challenging yourself, spending time with other people. I think those are all really important, as well as kind of activity and just general healthy living, getting your 5 a day, all the sort of stuff that a GP would say.
And of course, that sort of stuff is good for many things, not just preventing dementia. I need to listen to you and do more of that. So thanks, Simon. Another question, which is probably important for Simon to answer too, is what's the importance of getting a diagnosis? If I think I have a memory issues or the start of a dementia, you know, I'm not going to be able to stop it. So why would I get a diagnosis? What's important about that?
No, it's such an important question, and it does put people off seeking help, because sometimes people are a bit fatalistic about the diagnosis, but things have changed very much over the last 20 years. We've got better medicines and things that can help. We can identify risk factors much earlier. For Alzheimer's types dementia, there are drugs that can be incredibly effective at staving off deterioration. So we're really keen to see people early. The memory clinic, we've got an excellent memory clinic in Herefordshire. They're keen to see people early if they've got concerns. And often it can be quite the first thing that I see is, you know, I'm a bit forgetful. Is this normal? You know, what people are trying to work out, is this something that is abnormal, or, you know, I know.
Oi, mate, how you doing, mate? Did you drink your tea at Crumpet?
So it's all about communication, isn't it? So it's trying to, just trying to work out whether or not there's an issue, I think is the main thing. And so we've got good community dementia nurses who are able to see people for a chat and talking about whether or not there are whether there are concerns. And as GPs, we're keen to see people as well, to talk through, do investigations, check to see if there are any treatable causes. So things like mineral deficiencies, vitamin deficiencies, other issues. There are some very treatable causes, pressure on the brain and things like that. So we always do CT scans. But yeah, I hope that answers the question. We're keen to see people early on to discuss what we can do. And sometimes it's just a question of monitoring. And sometimes it is a question of identifying other conditions. The other things we often find are things like depression, or that's often a feature. If you weren't listening in the first place because your mind was elsewhere, it's really hard to remember things. So I'm always looking to exclude treatable causes like depression as well, but it's really valuable to see people and to treat them.
And I suppose it's not always just memory issues that could be the symptom. Could be looking at other things, low mood and balance issues and things like that, I guess, that could be related to dementia. Another question we've had around dementia is, what's the difference between Alzheimer's and dementia? Are they the same thing? That's a really common question. I guess you probably get asked that a lot.
Yeah, well, dementia is a global term for, I've heard it used as brain failure. Now, some people find that a tricky concept, but we talk about heart failure and we talk about kidney failure, and actually it's the same sort of process going on, but essentially it is an impairment of the function of an organ. So in this case, if your brain isn't working properly, you see a constellation of symptoms. There are certain subtypes of dementia, which Alzheimer's is the best known and the most common type, but there's also vascular dementia, and there are other rarer types than called Lewy body dementia, and there are some frontal lobe dementias and young onset dementia. So we get down into smaller groups. So the reason that we try and identify which particular subtype is it can help to see whether or not there is any treatment available to see. So we try and identify it, but actually for most people, the subtype doesn't make too much difference to the presentation. So, it's possibly more of a technical issue, but so Alzheimer's, vascular dementia are types of dementia. Does that help? Does that answer the question?
Sure does. Did any of you want to come back on any of the previous questions before we move on? Paul or Claire, did you have any more to add?
Chris, I think Magda may have a hand up.
Magda, are you waving at us?
I would like to ask on behalf of all of us. We are care staff at Hillside, and I would like to ask, what would be the key points of supporting residents in a residential setting for the carers and residents in different stages of dementia? How can we do that successfully? And that would be my questions. What would be the key points for supporting residents with dementia in the residential settings when there are certain kind of environmental issues and of course they are not home and there are other people, other residents. How can we navigate through this?
Paul, do you want to take that question first? Because I guess you commission care for people with dementia at all stages.
Yeah, I'll take it, and I'll hopefully Simon will finish it for me from a clinical perspective, I would hope. But absolutely, welcome to Hillside. I know you well, and it's nice to see you on the call and on the video. Ultimately, when we commission services for people with dementia, particularly residential services and nursing services, of course there are regulations, but that's almost a side issue. It's a regulated service, but of course, what we really want is for individuals to be just that. So we want the care to be person-centred. We want it to be individual, and we want people to not be put in specific boxes. So we want people to have care that suits them as an individual. So develop your care. It will go through phases, of course. So, people will go through development, and their dementia may unfortunately progress. So what's right today may not be right in 2 months' time, in 3 months' time, 4 months' time. So I would suggest, Magda, that and of course, just as a side issue, we are in the current position. We are, as we speak, looking to invest into Hillside to make it as dementia friendly and as dementia welcoming as we possibly can. That's a project that I'm running on behalf of the council with Hillside. And so decor can be important, environment's really important, ensuring that people have got items and environments that are familiar to them can be really important. So it is an individualised position, I guess. Of course, there'll be some clinical input required, which Simon will talk about, but I would suggest that making sure the environment is as dementia friendly, and it's a bit of a generic term, but make it as dementia friendly as possible, but also ensure that you adapt and you flex so that what's good today may need to change as the person progresses, unfortunately, down their road to dementia. And also continue with your research, talk to GPs, make sure that professionals are involved, and also ensure that you continue to talk to families where families are available, and you continually speak to the person who's suffering from the dementia, because of course their needs are the most important and their views are the most important. So ensure that you are individualized and that you apply yourself in the way that all of us would want to be supported and treated, because of course all of us at some point may be that person. So that would be my view, and there'll be a much more clinical and health related view that Simon will give us, no doubt.
Try. Actually, I'm really fully aware that we've got people who are far more specialists than me on the call, and I'd really like to hear from kind of Tracy, Shirley, and Claire, who are far more familiar with, actually about orientation, about how to improve the quality of life of people with dementia. As a GP, the time I really most get involved is around decisions about future planning of care. And this is tricky stuff. It's tricky territory, but we see far too many people admitted to hospital because it's the default process. And actually, I would question for some people whether or not it's an appropriate place of care to take someone who's got, say, an advanced dementia out of a place where they're known, where they're familiar, and put them into a busy ward environment. It's very easy to do. It's very easy to pick up the phone and ring an ambulance and get someone admitted, and it's much harder to say, is this the right thing? What are we trying to achieve? And that's the time when I get involved really in making decisions about appropriateness of care. What are we aiming to achieve? Because it's hard, but it is a life-threatening illness in the same way that cancer and other conditions are. And we have to be realistic about outlook and what we're trying to achieve. So things like advanced care planning, deciding what it is that people want to get from care, and making sure that the care they receive is appropriate. Medicine can do lots of very, very clever things, and they're not necessarily appropriate. I'm thinking of a patient of mine who went into heart failure and spent the 5 days of the last week of her life in hospital before someone made the decision that we weren't going to put a pacemaker in and she came home. But to spend the majority of the last week of your life in hospital with people that you don't recognise, I think that's really, really cruel. And so actually we have to think 2 steps ahead. What is the right thing to do rather than what is the knee-jerk reaction? How do we treat this? The treatment for a 30-year-old is very different to the treatment for a 90-year-old. And so it's having those talks, it's talking with people about what you would like. Sometimes if someone hasn't got the ability to decide for themselves, they haven't got capacity to make those decisions, then what would they have wanted in these circumstances? Because it's very easy for us to do the wrong thing. So as a clinician, that's the time I get most involved. But coming back to the question about orientation, there are far better people on the call than me about managing this day to day who are the experts on this.
Okay, Claire, you've been badged as the expert, so over to you. Do you have anything more to add about Magda's question?
I would say that a key point in all of it is actually knowing the person that you're supporting and caring for. And it's about knowing their personal history, even if you find that out through family members, they're the people that know them the best. But it's such an important part of personal care, and how people react as well, because how that person has been through their lifetime is how they will react with dementia. So it really is, I've always felt anyway, and what I've always preached, I suppose, is the real importance of knowing the person themselves, their background, their history, their likes, their dislikes, everything. And I think once you know that, it kind of then gives you the ability to know how to deal with somebody. If somebody's walking with intent, for instance, you know, let them walk, providing they're not going to be in danger of harming themselves or others. Let them walk, because they have a purpose in their minds of what they're doing. Just because you can't see that purpose, and to everybody else it appears to be aimless wandering around, it's not. That person has actually got an aim in their mind as to why they're walking. Some people find it very difficult with dementia to actually sit still. That's another factor. There is so many different factors that are involved in it, really, that I think there's more than just a few key points. But as I say, my biggest thing is just really knowing the person that you're caring for.
Thanks, Claire. So another question has come in. So what would be the best way to approach somebody sensitively if you suspect the signs of dementia in a friend or loved one, and you think they might not respond very well to it? How do you have that first conversation? Who'd like to take that one first? I'm going to choose one of you.
I'm happy to do it, because it is.
Off you go, Simon. Yeah.
You know, people turn up to us with that, and it is tricky. It's hard to have those conversations sometimes. I think my experience is people actually are less concerned about being asked than you expect. It really varies, and it's hard to give you a one-size-fits-all rule, but actually sometimes people know there's something wrong, and actually just acknowledging it can be helpful. So it's finding a sensitive way to say, are you aware that you know that this has happened, or that you know that you've asked that question a few times? And certainly from our point of view, as I say, as GPs, we're very keen to see people. So, you know, sometimes it's a way of getting in to see us so that we can have that conversation, because it's much easier from my point of view as a GP. I've not got the emotional connections, and I'm not going to be shouted at the next day, you know, if there's a concern, or if we've phrased something wrong. So it's and sometimes it is just contacting the surgery. I've got some people who I know there are concerns about, and that they're going to come in when they feel ready to do it. And I think there's quite a long process from recognising there's something wrong to making the decision to come in and see someone about it. But the other thing is just learning as much as you can about it, doing the Dementia Friends, looking up stuff about it, and just educating yourself as well. I think it's really helpful.
Thanks, Simon. Shirley would like to ask a question to the panel.
Oh, yes. Well, it's probably to Paul, actually, but it's a general question. It's Simon talked about early diagnosis, and it being really, you know, it's really important to get early diagnosis. But one thing that we've got some really good examples of community-based support across Herefordshire, outstanding. You know, with the meeting centres and some of the cafes and such like, but it's a bit disparate. And, you know, we'd had support previously from the Council for Leinster Meeting Centre. And some of you will know, and some of you won't know, that in Worcestershire, there's support from Worcestershire Council through the business rates pilot for 9 meeting centres across Worcestershire. I'm not asking you for this money, Paul, but what I'm saying, how can we replicate this in Herefordshire? You know, I've got a bit of an idea and a plan, but how can we do that? We don't need 9, but we need some, and it would be a mix of more cafes, 3 or 4 more meeting centres. And I guess it's just how can we work together to take that forward?
Well, the short answer is I don't know, and the long answer is I would like to. So let's talk about it, and let's have that discussion, because ultimately, you know, obviously I've been to the Wempster Meeting Centre, and it was an incredible resource that the community benefits greatly from. And I do recall at that meeting centre in Wempster, that talking to one couple who'd come from Hereford City, proving just how valuable the resource is, but also proving that there's a need in the city perhaps for a similar. And of course, we've got the market towns, which of course, we've got the services in Ross, which will, I'm sure, reopen as the pandemic starts to cease. And of course, we'd like to talk about other market towns. So let's have a conversation is the honest answer. Let's be frank, finances are not great, given where we are in the pandemic. But I think that you and Claire have proven that with enthusiasm, creativity and innovation, you can create money from nowhere, because let's be frank, that's what you've effectively done. You've created an organisation from zero in less than 12 months, and I believe that organisation's profile and the work it's undertaking is absolutely amazing for the communities that you support. So let's talk about that, because that's proper commissioning. Commissioning is not about handing money out and saying, can you do this? Commissioning is about creativity and innovation and working together as a sector. So let's try to do that.
Okay, yeah, well, I forgot to say there is going to be a meeting centre in Hereford at Drybridge. It's Age UK is setting one up, and it's going to be for ex-service people. So that's another one, but it's about linking it up. Thanks, Paul.
Okay, thank you.
Does anybody else on the call have any questions they'd like to ask before I dive back into my list? Anybody else want to come off mute and add anything in? No? Amy did put a comment in the chat about the benefit of using various memory sharing apps, which are really good for working with loved ones with dementia, for anybody listening who might be interested. The next question I have, and it's one I'm sure Simon's heard before. If I get a diagnosis of dementia, does it mean I'm going to lose my driving licence?
No, not necessarily. Because there's such a variety of presentations, some people with dementia have still got perfectly preserved skills to be able to drive. So it certainly is one of the things that put people off seeking help, but a diagnosis of dementia does not automatically mean loss of a driving licence. Often the memory team will suggest having a review of driving to check that someone is still safe, but there's no automatic disqualification. And so I really like to feel that it doesn't put people off seeking help, because obviously, especially living in a rural community, that can be a concern for people.
Claire, did you have anything to add in terms of the dementia support you offer around those kinds of issues that people have?
I mean, yes, we do. I mean, Cheryl Paul, one of my team members, is and has been a community dementia nurse for a very long time. And she's more than happy to have that sort of pre-diagnostic conversation with people about offering support, and the fact that no, actually, it doesn't automatically mean that you will lose your driving licence. But I do agree with Simon on that point. It is, I think, the worst misconception that everybody has in this county. And it's a natural fear, really, because we are such a rural county. And I think especially in areas where it's mainly farming community, the impact that somebody losing their driving licence could have on their day-to-day life and work. If you're a farmer and you can't drive a tractor, well, what happens then, So I think actually we could do with doing a bit of work around that, because it is one of the greatest fears that we come across. And we're happy to have that conversation with people. I'm sure, carers groups would be happy to have that conversation with people. But it's also about maybe getting it out at grassroots level. And for sort of social prescribers, people like that, to be able to have that conversation, sort of making it clear it's not an automatic result of a diagnosis. I mean, I've known people go on to drive for a good number of years with dementia who, because they haven't progressed, Yes, you do have to have a retest, but they've still gone on to drive for a long time, even with the diagnosis. So, but it is certainly a subject that needs addressing, I think.
So Melanie on Facebook has said that her dad has vascular dementia, and he started to get quite aggressive when he's talking, and she has to try and calm him down a lot. And she said, he's on a pension, and how can I get some support for him?
So the first thing is to remember it's the disease, not him. It can be hard when it's someone who loves seeing behaviour change, but it's the disease, it's not them, and that helps to see through the behaviour to see what's causing it. I would very much hope that your father has got a diagnosis and should be getting some support from the community dementia nurses. If not, it's really important to see a GP and to get a diagnosis. If they have a diagnosis, you should have a community dementia nurse who should be able to help to address some of these issues, because there are medicines and other techniques that can be useful. So in the circumstances, I'll contact the dementia team and ask for their help, and hopefully you'll have their contact details if you have a diagnosis, because it's an ongoing support that's available.
Thanks, Simon. Paul, did you want to add a little bit about how adult social care support works?
Yeah, absolutely. Of course, Simon's point about the diagnosis is incredibly important, because that starts the chain of events then for support to be wrapped around the individual. And of course, it's a layered approach. In the first instance, of course, with or without a diagnosis, there are community groups that can be used to support individuals. Of course, there's community resources. Make sure that if there is a family dynamic, that can be exploited as much as possible, because families can help to support individuals. But if we reach a position where the family believes that the individual requires formal support from the local authority, and that will be there'll be a journey to get to that point. Of course, adult social care can undertake an assessment of the individual to see what their needs may be, and of course, then that will depending on how their needs are assessed and the financial position, etc. There may be more formal support available to the individual. But that should be quite a way down the line, and that's simply because there are a number of interventions that can be made before formal care is required, and it is much better for the individual to use the community assets available, to use family if that's available, to get a formal diagnosis, and to build into the networks of support that are there from the voluntary sector, from community groups. Talk Community, of course, has its own directory where a number of these services are available and listed, and we can provide linkage to the Talk Community of a directory. But of course, a formal assessment can be undertaken if we reach that point. And of course, a very large number of people do receive formal care services from the council. Depending on your financial circumstances, sometimes you pay for those and sometimes you don't. And there will be a financial assessment undertaken to determine that. And of course, that will depend on the individual circumstance. But I would really suggest that we do as much of the community and Talk Community and the voluntary sector and the community assets are exploited before seeking a formal care assessment, because it's not a quick fix. And becoming dependent on formal care services to maintain your independence. It's not an easy choice. It's something that many people would resist quite strongly. But of course, in terms of care services, our absolute mantra is that home is best. So if you can be maintained in your own home with support, either formal or informal, of course, that's our preferred route. Because as Simon has already said, particularly with a condition such as dementia, familiarity of surroundings is so important to ensuring that you can live with dementia very successfully. Great to see that Claire's suggested that people have continued to drive and take an active part in the community with a diagnosis, because again, that's to be encouraged. It shouldn't be, a diagnosis of dementia is not the end of your social interaction with your community, and it's not the end of your independent life. It needs to be we can work with that very, very successfully and ensure that you continue to have a really fulfilling and socially interactive and maintain your well-being for a number of years, if that's possible.
Thanks, Paul. And of course, to add on to that, there's also the possibility that carers that are supporting family members can also have an assessment and receive carers allowance if they're eligible. And I guess that would also be a call the local authority to find out about that.
Yes, it would, of course.
Yeah.
Yeah. Can I just say, Christine, can I just pop in here that also there are organisations such as Age UK, Carers Links. They will all support people to get attendance allowance and things like that, which can be used to support the person. So, you know, that there's a lot of organisations in the county that can form a support network, if you like, around that person to help them through the situation.
That's great. Thanks, Claire. Now we've reached 4 o'clock, so we've not really got any time for more questions. So I just wondered if panellists wanted to make any closing remarks, given that we're in Dementia Action Week, before we finish. And thank you all for coming, and thanks for the panellists for their attendance and words of wisdom. Paul, shall I come to you first?
You can. Thanks to the panellists and thanks to Healthwatch and other partners for organising today's session. I think it's been incredibly useful, very valuable, and hopefully people that have attended on Zoom or people that are listening or watching on Facebook have also seen some benefit from this. It is really encouraging to see the amount of resources and the support and the efforts that are going into Herefordshire from all parts of the community, and then of course from the voluntary sector and the more formal services. We can beat this, and we can ensure that people do live with dementia incredibly successfully if we all work together for the benefit of those individuals. And I think that there's been some evidence today that we are doing that very successfully in Herefordshire, but of course we can always do more. We've got some really passionate GPs, we've got some passionate voluntary sector organisations, and we've got some passionate officers within the statutory services that are all working together to try and ensure that we cannot beat this illness perhaps yet, but I'm sure we will in the long term. But absolutely we can minimise the impact of it, and I think we're doing that quite successfully. And of course the pandemic hasn't made it any easier, but hopefully we are coming out the other side of that. So thank you for your time. It's been a real pleasurable hour, so I do appreciate the opportunity. Thank you.
Thanks, Paul. Claire, can I come to you next?
Yes, there's not much I can really add to what Paul's already said, to be honest. Thank you for the opportunity that, you know, we've been given. I hope people have found it useful and informative. And it's certainly been, I think, one of the highlights of Dementia Action Week, actually, to put up together a panel and answer the people's questions. What better way can you go? So thank you for doing so.
Thank you too. And Simon, final word from Dr. Simon Lennane.
Thank you.
Drum roll.
Yeah, it just feels like, you know, I keep coming back to prevention, and, you know, especially coming out of lockdown, is really just around making those connections again, seeing people, talking to people, rebuilding those connections that we've lost over COVID, because they're so important. You know, looking after yourself, making sure your blood pressure is controlled, keeping active. All these things are the things that keep us well and can help stave off dementia later on. But I just think, especially now, we've lost a lot over COVID, and now's the opportunity to get back to normal and start rebuilding those connections. So get outside, enjoy the sunshine when it is, and you get some sun in your skin, and actually catch up with people, because it's safe now, and it's a really good chance to do it. We've had a shocking year, but it's now time to make up for it. So that would be my top tip, is just get out and see people.
Great. Nice note to end on. So thank you for that. We'll make the recording available, and you can find it on our Facebook page, and you can share it and direct people to it when the event's finished. So thank you very much again, and have a nice day. So I'll just press end and we'll all disappear.